Hello, everyone. Welcome to another episode of Critical Behavior, where I, Isabel, help you master pharmacology content, think critically, behave critically, and really master and nail your exams. So, without further ado, let's get started. So, I'm going to begin with a little case study for you. You are a new grad nurse working in the emergency room. You have a report that you're getting a patient coming back. He's a 5-year-old boy. He's here with his mom. He is suffering a severe anaphylactic reaction after having a cookie at his friend's house. This is the first time he's ever had a reaction like this. His mom is worried. The kid's condition is not well. He is having a very hard time breathing. And you as a nurse know you need to act. So you're going to have to give him a drug as an intervention to help relieve his symptoms. And that's what we're going to be talking about today is what kind of drug we're going to be giving. And in this situation, we'd probably be giving epinephrine. So what is epinephrine? Epinephrine is also known as adrenaline. And many of us know what adrenaline is. It naturally is in our body. So epinephrine or adrenaline is a part of the drug class of an adrenergic drug. So what that means is that this drug needs to bind to these receptors in our body to turn on and elicit a response. So what epinephrine does is it binds to receptors throughout our body and stimulates the sympathetic nervous system, also known as a fight or flight response. So that's what epinephrine is going to do. So before I get into kind of when you'd use epinephrine, what are their side effects, contraindications, it's really nice to know the mechanism of action and what the drug does and acts on, because then it kind of explains all those other aspects. So epinephrine binds to alpha-1 receptors, and what alpha-1 receptors, when they're turned on and activated, it causes our blood vessels to constrict. It's vasoconstriction. So that also causes an increase in blood pressure. So perhaps an indication that we would need epinephrine is if a patient is in shock and their blood pressure is dropping. They're very hypotensive. We would want that blood pressure to go up. So epinephrine would be a good choice there. Epinephrine also acts on beta-1 receptors. Beta-1 acts on the heart. So it increases the heart rate, increases heart contractility, and it makes the heart more effective. So what would be a good indication of needing epinephrine in this case? Well, if your heart fails, if you're having heart failure or cardiac arrest, epinephrine is a very good drug to use, and in fact, it's used often every 3 to 5 minutes in someone who's having cardiac arrest. You're doing CPR, you administer epi, and you do a pulse check every 5 minutes or every 3 minutes to see if you need to give some more. So that's a very good drug to use in that situation. Also, beta-2 is another receptor that epinephrine activates. So beta-2, you have 2 lungs. Beta-2 acts on the lungs. So it causes those lungs to open up. It causes bronchodilation, which is really great in our case study that I talked about with that severe anaphylactic reaction. The lungs are closing in. Patient's having a hard time breathing. We want to open those lungs up as soon as possible. So epinephrine is a really good choice in someone who is having a hard time breathing and you want to open up their lungs. So a little mnemonic I came up with, indication you need epi is as easy as A, B, C, D. A standing for asthma, allergic reaction, anaphylaxis. B for bronchoconstriction, kind of along with what I said in A. C, cardiac arrest. And D, decreased blood pressure such as shock. So epi indications are as easy as A, B, C, and D. So now let's get into some side effects and adverse effects. So some side effects could be you could become too tachycardic, too high of a heart rate. You could become too hypertensive. That blood pressure could rise too high. And if that blood pressure rises too high, an adverse effect could be cerebral hemorrhage due to that vasoconstriction. And that's also why we want to constantly be monitoring our patients. Could also cause dysrhythmia in a patient. Angina, which makes sense. You're increasing your cardiac workload and can cause some chest pain. Can also cause local necrosis. Hyperglycemia. And why is that? Because if you think about that fight or flight response, we're needing extra sugar to help our skeletal muscles contract. So that's causing that glycogen to break down, increasing our blood sugar. And if you have diabetes, hyperglycemia is a concern and side effect, an adverse effect. So it can also cause anxiousness as well. So those are just some of the side effects of epinephrine. So now let's go into 2 incompatible drugs, or drugs that interfere with epinephrine. The first one being beta blockers, such as metoprolol. Think about this. Beta blockers block those beta receptors, and those beta receptors, like we said, are what we kind of want epinephrine to stimulate and turn on, but when they're blocked, you can't do that. So it kind of blocks that fight or flight response from even working. So that kind of really affects how epinephrine works in our body. Another incompatible drug with epinephrine that we do not want to use together is an MAO inhibitor. This is because MAO inhibitors suppress the activity of MAO, and MAO has enzymes that inactivate epi. So when we suppress the activity of MAO, we are prolonging and intensifying the effects of epinephrine in our body. So we do not want to mix MAO inhibitors with epinephrine, as it is going to intensify and prolong our response to epinephrine. We also do not want to always use beta blockers, as that may interfere with how epinephrine responds to our body, especially in emergency situations. So now let's go back to that case study. Now we have given epinephrine, we've been monitoring the patient is stable and ready for discharge and ready to go home. We're sending them home with an EpiPen. What are we going to do next? Think critically. Should we just send them home? What are the next steps? Well, as a nurse, you should know it's our job to educate. So when should the patient take this drug is a good thing to educate them on. The patient should take this drug in an emergency. So remember the ABCD indications that I mentioned earlier: asthma, bronchodilation, cardiac arrest, anaphylaxis. Now, if someone was having cardiac arrest, you wouldn't take this home with them, but this is normally for an EpiPen. Remind them to take it only in emergency situations, severe reactions, etc. Do you take this drug with or without food? Often, again, given in emergencies, do not need to give it with food. We just want to give it right away. Safety concerns, though, absolutely. We want to address those. So we want to teach the mom to monitor this patient after they give this epinephrine. It's always a good idea to come in even after if they had a severe reaction, because we want to monitor that blood pressure and that heart rate, make sure it's not too high. Make sure there's no irregular rhythm. If they had cardiac arrest, we want them to be hooked up onto that cardiac monitor, constantly monitoring. We also want to monitor their breathing, their airways. We want to make sure that the patient is stable. Now, any dietary restrictions? No, not really. Not with epinephrine. It's not regularly taken. However, there might be a dietary restriction given why you needed epinephrine. If you're in cardiac arrest, you might need to adjust your lifestyle, your salt intake, your cholesterol, or if you had an anaphylactic reaction to peanuts, you might need to change that out of your diet. However, when taking epinephrine, there's no dietary restrictions. Lab work to consider, again, maybe blood sugar. You want to monitor that, especially if someone's diabetic. You want to make sure there's no hyperglycemia effects from taking that epinephrine. Finally, most importantly, tips for adherence are huge. Emergencies are never planned. You want to teach your patient, if they're going home with an EpiPen, to take the EpiPen with them always. Store it in a safe place. Minutes count when someone's having an anaphylactic reaction. Set up reminders. Teach them how to give an IM injection correctly into the vastus lateralis. And here's my bonus question for you guys. How many Americans die every year due to an anaphylactic reaction? Well, the answer is 6,000. And that's quite alarming because many of those could be avoided if we acted fast. So this goes into my case study, which talks about how many people who have severe food allergies actually carry the EpiPen around with them. And unfortunately, the research study showed that 60% of people said that it should be carried with them at all times, but only 40% of people had it with them when they were in the clinic and these people were doing the research study. And of those 40 people that were actually carrying their EpiPen with them, 50% of those people were carrying expired EpiPens. So for me as a nurse, that says that we have a job to do and we really need to educate our patients on the importance of carrying these EpiPens with them. Again, emergencies are never planned. We want to make sure that our patients are not one of those statistics I mentioned in my bonus question. So I hope everyone was able to take something away today and was able to learn and think critically about epinephrine. Good luck on the exam. You guys will all ace it after listening to this. Thank you.